Hi there, and welcome to Aging Well in Virginia. I'm Jane Foy. We are talking today from the Jefferson Area Board for Aging offices in Charlottesville, Virginia. It's a AAA agency, as there are many, about 25 in Virginia. One of the things that they do is a free program, Medicare Insurance Counseling. It's a great program. And today we're talking to Randy Rogers, who is the manager of the Medicare Insurance Counseling here at JABA. Thank you for being with us.
Thank you for having me.
I'm delighted. Before we get into the how do I get onto Medicare question,
Yes.
if I retire at 63 and accept Social Security, which I believe you can do at 63,
Yes.
instead of 65 or 67 or whenever else after, can I then participate in Medicare at age 63?
No, the two programs are a completely disconnect from each other. So when you are eligible to collect your Social Security is a whole different system than when you're eligible for Medicare.
And Medicare is?
It's predominantly you'll see people 65 or older, but you also have people who are on disability, Social Security disability, that are on Medicare younger than 65.
All right. Glad that you cleared that up for us. So let's just jump into it. Part of the aging process these days is, quote unquote, getting on Medicare. So how do we do that?
They've made it easier and harder at the same time. To enroll in Medicare, basic Medicare, just starting out, you can do that on your socialsecurity.gov account, and that's you just apply through Social Security. They're the gatekeepers to allow people into Medicare in a sense, and it's a artifact from a bygone era when it was all done in paper and in person, and Medicare didn't have boots on the ground in each community, but Social Security did. So they put Social Security in charge of the enrollment process for Medicare. So now you can do it online. You can still fill out paper forms and submit them and mail them to Social Security, but less and less can you just go into the Social Security office and try to do it in person there.
Okay, so that's where you come in.
Yeah, we can help with that process. We're the people you go to get advice, to get knowledge on and what your options are, what might be the best answers for you, because everybody, their needs are different. So how they set up their Medicare will be different from person to person, and it is a wildly complicated process.
Indeed, indeed. So when you enroll in Medicare, correct me if I'm wrong, you get parts A and B.
You can, yes.
You can.
Yes. Which, if I could back up to a question, I mentioned, we talked about this before the podcast, that if somebody approaches us and says, I'm turning 65, should I enroll in Medicare? There's not a straight answer to that question. There is, are you going to continue to work and have insurance through your work? If so, then you may enroll in parts of Medicare and not other parts of Medicare. And that all differs. If you work for a employer who's got less than 20 employees, you have to enroll in A and B. If you have more than that, then you don't have to enroll in both A and B. You may elect to enroll in A, but if you have a health savings account through your insurance at work, you don't want to enroll in A. So it gets really complicated. So each individual person, the answer to that question is different.
It's different. Clarify for me, if you will, what is A and what is B?
A is hospitalization. It covers a lot of different things, but we jokingly call it your hotel stay at the hospital. It's your being there in the hospital, the nurse is taking care of your food, your bed, those type of things. But the bulk of other medical things, such as the doctors or the surgeries or things like that, would be covered under Part B, even if they're in the hospital.
Okay.
Yeah. So, but A does cover hospice and some other skilled nursing facilities when you're rehabbing from a long hospital stay. But the workhorse is really B. That's when you're going to the doctor's office, your tests, your therapy, your surgeries, those things.
Okay. All right. So I'm 65 and I'm retiring.
Yes.
Not working any longer.
So we're going to go on to Medicare.
We're going on to Medicare.
Okay. So we're going to enroll in A and B through Social Security, and then we have our choices. You can go with original Medicare or Medicare Advantage. Original Medicare would most likely be set up where you have your A and B that's paying 80% of the medical bills, and then you get a supplement through a private insurance company, and it's basically picking up the 20%. There's some nuance to that, but that's the generality of it. And then you pick up a prescription plan to cover your prescriptions, and those are optional, but most people pick those things up. Or you could go on Medicare Advantage, where you roll up all of your Medicare and you hand it over to an insurance company to manage. Medicare Advantage is tricky. There are parts of the country that have great Medicare Advantage plans, and when you go to use them, they work really well. And then there's other parts of the country, like us, whose plans are not as good, and when you go to use them, you will run into problems sometimes. And so whether Medicare Advantage is a good option for you depends on where you live.
All right. And so it is a counselor such as you and your volunteers who will explain that to me.
Oh, yes.
I can make that decision once I realize pardon the expression, what advantages there are.
Yes.
Okay. So we're at A and B. Then how do we get down? Then where do we go? C, D, E, F, G?
Well, what you would then is A and B, a supplement plan, which they have their own set of letters. They could be G, they could be F, they could be N. And then a prescription plan on that side. And then Medicare Advantage is technically what's called Medicare C, but nobody calls it by that. It's Medicare. Everybody just refers to it as Medicare Advantage. So again, we draw it out on a piece of paper, on the left side of the paper, right side of the paper, and a solid line through the middle. You got to be on one side or the other. You can't pick from both sides. So it's either original Medicare or Medicare Advantage.
So now I'm looking for that supplemental insurance company that will pick up the 20% that
Yes.
B does not.
Yes.
Okay.
Yeah.
Are there insurance companies that are okayed by the state, or do they need to be qualified? Or?
Yeah. Anything sold in the state has gone through the Bureau of Insurance and has been vetted for that, and the pricing has all been run through the Bureau of Insurance. It's an interesting thing that people think that's a complicated process or decision-making process. But once you've decided to do original Medicare and you're picking out a supplement plan, it actually becomes really easy. You pick the letter you want. A lot of people go with G, some people go with N. If you're older, you are available to get an F plan, but those are kind of the big three options. Once you pick it, it doesn't matter what insurance company you go through, because by federal law, every company's G policy, so G, is exactly the same. No one has a better one. No one has a worse one.
Oh.
They do one job. They pay the bill that Medicare sends them. So Medicare pays their 80%. They send them their bill. They pay it. No questions asked. That insurance company has no say in your medical health care. It's just now between your doctor and Medicare. And for the most part, it's just your doctor, your provider deciding what your health care is going to be. There's no insurance company getting in the way and telling them what they can and can't do. So you're going to now pick, let's say, G plan. You're going to go, okay, each of these companies are exactly the same. One one's better or worse than the other one. You go with the lowest price.
It comes down to that.
It does. See how simple it becomes? It just goes like, let's go with the lowest price. And we can look that up. You can look at the Medicare website. They've got a tool on there, but we can see really what the brokers can as counselors, so we can get a more accurate number. And so if we look at it and it says it's going to be $120.02, and you call up the company to sign up for it, it's $120.02.
How is it that some insurance companies that are dealing with Medicare can charge less or charge more than another?
Right, like a G plan, why is one $100 a month and another one $450 a month? Well, each company is deciding their risk assessment and stuff of that pool that they have, and so they're picking the price on what they feel they need to collect for that pool. However, people will ask me, why would I go with a company that's $40 more, or why would somebody do that? I go, well, you end up chasing the name of an insurance company because you're like, oh, XYZ insurance company has been good to me all these years. I would, I want to go with them, when that's really doesn't need to be part of your decision-making process when it comes to this type of insurance. When you're buying homeowners, car insurance, stuff, the insurance company is important. How well are they going to take care of you? Are they going to pay out? What's the reputation? I have insurance through the same insurance company since I was 18 for my car and my homeowners and all this stuff. I would never go with them for a Medigap policy, a supplement policy, because they're wildly overpriced.
But not for your car and your
Yeah.
and your homeowner.
Yeah, that's why it's like, you got to disconnect any history that you have. I tell to people, I say, look, everything we've learned in a lifetime about dealing with insurance companies or picking insurance companies, all that gets thrown over your shoulder when you go to buy a Medigap policy.
All right. Does it make a difference? You referenced car and homeowners. I mean, I can get in my car and go downtown and walk into the insurance company that I've been dealing with for my homeowners and my car insurance, and there are humans there,
Yes.
that I talk to on the phone and I see. Is it important that, or does it matter at all, if when you're picking your plan G, that it's with a company that is in your hometown or your district or your area?
No, as long as they're selling where you're in your zip code, yeah, it doesn't really matter because, as I said, they have one job, they pay the bill. I've been doing this a long time. Not a single client has come back and said my Medigap didn't pay their part of the bill.
Okay. And you determine which company you're going to use by your zip code.
Yeah. But when we go searching, we will put your zip code in.
Mm-hmm.
We'll go female, age 65, non-tobacco smoker. That's all we have put in, and it'll get now list from the least expensive to the most expensive plan.
Well, let's say, for instance, since we are in fact physically in Charlottesville,
Yeah.
And a 22901 zip code.
Yeah.
If you were to put that in, how many insurance companies would pop up?
For like a G plan, about 30.
30.
Yeah.
Oh my, I had no idea.
Yeah, this is what I tell them. It's like, you don't care what insurance company you go through for this type of plan. You don't even care if you've ever heard of them. Because if you, let's say for some reason, I've never seen this, a company goes under, or so, you get a new open window to go get a new one without any medical questions asked, and you're right in with your next company.
Let's talk about area agencies for aging.
Yep.
AAAs,
Mhm.
they are called. I think I've been told there's about 25 of them in the Commonwealth. JABA, which is a Jefferson Area Board for Aging, is one of the larger districts, I think.
Yeah, well, it has a very large program. We're very fortunate in Charlottesville that JABA has done so much outreach and does so much varied programs, more so than maybe some of the others in smaller communities or so.
And it's not just the city of Charlottesville, it's surrounding counties. So it's a fairly large land mass.
Yeah, we're responsible for Charlottesville, Albemarle, Greene, Nelson, Fluvanna, and Louisa counties.
Okay. If you are not from that area,
Mhm.
but you still want to get in touch with your AAA to get advice, how do you manage that?
Each of these AAAs, they all have websites and things, and they're all, they all have different names, like JABA has its name and everything. So, but you could always call DARS, the state agency that's in charge of the AAAs.
That's the Department of Aging and Rehab Services. Yeah. So that's the state agency, and all of the AAAs are answer to the state.
Yes. And they can get you there. And really, if you called JABA and said, hey, I live in Buckingham County, can you get me the number? We have those numbers. These AAAs are not only in Virginia, it's every state has the same situation where they have AAAs all over the state. All of them have an insurance counseling department. And so if you call me and say, oh, my aunt lives in New Jersey, I can give you the number of the New Jersey insurance counseling, and they can get you to your local one.
And no matter which AAA you avail yourself of, it's free.
Yes.
Okay. Because that's a very important That's very important to know.
Yeah, we're part of the federal SHIP program, State Health Insurance and Assistance Program. They sort of lost the A in the acronym somewhere, but that it's there to provide free, unbiased counseling on Medicare.
That's also an important that word unbiased, because when you say there's 30 insurance companies, I haven't heard of 28 of them. They each have a different pricing structure.
Yeah.
How do I decide? And you decide by price.
Yeah, for that particular type of insurance, yep.
Where does the drug
Yeah, your Part D,
program,
yeah, Part D prescription plan.
the prescription plan, is that separate?
That is separate. You get a separate plan to cover your drugs, help cover your drugs. The easiest way to do it is like our counselors will go on to Medicare.gov, put your drugs in, put your zip code in, and what pharmacies you use, and then it'll kick out and go, here's the best to the worst plan matching your prescriptions and your pharmacies.
So would you get two bills? Like one from the insurance company, you pay monthly, and then one from the prescription drug plan, you pay monthly.
You could, yes, but you can also have the prescription drug plan, the premium taken out of your Social Security check automatically, which we advise. It's one less bill to worry about, and you won't miss a payment. Now, the supplement plan, your G or whatever letter, that you have to set up with the insurance company directly, and that we always suggest put that on auto pay, because once you're in on the program, they can't kick you out for any reason except you forgot to pay your premium.
Which also brings us to pre-existing conditions. When you're looking at this insurance coverage for Medicare, do you have to?
Here's how it would work. We're still on original Medicare over here. Pre-existing conditions are not a factor on Advantage plans, but we're on original. We're looking at a supplement plan. When you first start your Medicare Part B, you get a 6-month window of what's called a guaranteed issue rate. What this means is every insurance company has to take you. They have to give you their best price for your age, zip code, or male or female. They can't ask you any medical questions, anything about your medical history at all, except do you use tobacco? And they still have to take you. It just ups the price a little bit. So you get one when you first start your B. You get in, great, you're in. Doesn't matter what kind of health problems you have after that or before that. Once you're in, you're in. And they can't raise your price for your health. Now, your premium will go up by your age every year. 3.5%, 4%'s been the average over the last 10 years. And so, that's inevitable. That will go up. But that doesn't matter whether I got a person who can run a marathon or a person who has cancer and has had 3 heart attacks in the last year. Their price is going to go up the same.
Okay.
And so that's once you're in. Now, if you wait to go get a supplement plan after that 6-month window, or if, let's say, you didn't pay your premium and you lose it, and now you got to go get one again, now they can ask all the medical history questions in the book to determine if they're going to take you and at what price. And so now it becomes a little stickier trying to get a Medigap policy.
So it is important when you sign up to do it all before 6 months. Again, bringing us back to having a counselor, an unbiased counselor, remind you of all these things that need to be done so that you get the best advantage.
Yeah, the best situation.
Best situation for you.
Yes. And again, we'll work it through because there's all kinds of factors. It's like, oh, they may be low income and be on Medicaid or have other programs. Well, that changes how we're going to do things a little bit. There's all kinds of various factors that happen. And that's why there's no, this is the answer for everybody. That's why you sit down with the counselor.
All right. That brings us to another question, because these programs, these unbiased insurance counseling programs are free. Obviously, you're going to need a lot of volunteers.
Mm-hmm.
So what do you need to know or study or be certified in order to become a volunteer? Because you've just imparted a great deal of information off the top of your head. You have no notes in front of you. I know you've been doing this for a while, but still it's complicated. So what would I have to go through to say, Randy, I have some time. I'd like to be a volunteer. I used your program. I liked it. How do I learn how to be you?
Yeah, yeah. Well, we have, since we have levels of volunteers, some of them are trained just to do the prescription part. And those ones we train in the late summer, early fall, and they'll go through about 15 hours of training before they ever see a counselor, including using veteran counselors as pretend clients to practice and everything. Now, to be a year-round counselor, to do the whole thing, all of Medicare, things we've been talking about, they do class training in January and February, and then they will shadow counselors for 3 to 6 months before they're ever let loose with a client on their own, because it is vastly complicated, and it's very important to get it right. And surprisingly enough, we have 70 volunteers who volunteer to go through all that training to do this because they see the value in it and they know the importance of it.
Absolutely. And I'm impressed with the number of volunteers that you have. But again, this is a rather a large AAA,
Yes.
and there are some places in the Commonwealth where their agency is much smaller. But still, if you're going to be a volunteer, you have to do no matter where you are in Virginia, you have to go through the same.
Every AAA does their training process differently. And this is just how we have decided that we're doing ours because we want to be thorough with it. And the volunteers themselves appreciate the fact because they very quickly realize how complicated this is. So they want more training, more knowledge all the time. And then when, like, for those Part D counselors that are maybe doing open enrollment in the fall, they're where veteran counselors are walking around kind of keeping track or available to answer questions or to jump in when needed to be. So even your first year of counseling, you've got our motto is you are never alone.
Right. And things do change, and you do and you do have a busy time of year.
Oh, yes. Yes, last open enrollment, we saw over 3,200 people in 7.5 weeks.
Just here at JABA.
Just your job.
That is impressive. Thank you for all of this information. Thank you for what you do. Thank your volunteers. Terrific program, and I'm so glad to know that it is available statewide.
Yes. Yeah.
Because we're talking about aging well in Virginia, and eliminating a lot of confusion helps in aging well.
Yeah. Yes. We do what we can.
Thank you for being with us on Aging Well in Virginia, and we want to send a special thanks to INL Event Production for our video equipment. Also, if you would like to get in touch with us, you can go on to agingwellinvirginia.com, our website, and it's for JABA and Randy Rogers, who we've been talking to today. You can go to jabacares.org. Thanks again. We'll see you next time on Aging Well in Virginia.